Does that mean enough people will actually sign up to meet goals? Joining us now, Jeffrey Young, healthcare reporter for the Huffington Post. I imagine you've been extremely busy leading up to this.
That's right.
Okay. Let's talk about the big picture. How is enrollment going overall for the Affordable Care Act?
Well, it's really mixed depending on where you live, but nationally, we're at about 5 million people who've signed up for private health insurance using these exchanges, and then some millions more who've enrolled in new Medicaid benefits, depending on whether their state has expanded that program.
Right. If you're looking at that graphic and you're saying, well, hey, who's wrong? Is it Fox 5 or is it Jeffrey? Jeffrey's right. The number has gone up for total enrollees now. You said about 5 million. You see the numbers, how it breaks down. The federal exchange, 2.6 million. And then in the state or the regional exchanges, Maryland, just about 248,000, D.C., 30,000. Are those numbers overall where the federal government would like them to be?
No, not yet. Initially, according to congressional estimates, they were looking to sign up 7 million people on private insurance during this first 6 months of enrollment. That's been downgraded to 6, and with only about a week or so left, exactly a week, in fact.
Right.
1 million people in a month, maybe they can pull it off, maybe they can't. And locally, in Maryland, they've had some significant problems with their technology, even more so than the widely known problems with healthcare.gov, the federal site. So they may come in under their estimates up there, too.
And is that the only, and this might be, a silly question now at this deadline, but is that the only way to enroll? Because who can forget the rocky rollout of the website?
It's not. People can still, just like before, they can go directly to an insurance company and buy a plan from them. Okay. They can call an agent or a broker and get help. But the only way to make sure that you can get tax credits that can cut the cost of the insurance if you qualify is to go through an exchange.
Okay. Let's talk about the deadline. It's a hard deadline, March 31st?
That's right. Now, I couldn't blame anybody who might think it's going to get delayed because the Obama administration has delayed and changed a lot of things on the way to where we are right now. But the president just yesterday said this is last call. Now, if your life changes, for example, if you get married or you move to another state, you can change insurance at any time during the year. And if you're eligible for Medicaid or for the Children's Health Insurance Program, there is no deadline for those. But anybody who thinks, well, Obama delayed this and Obama delayed that and doesn't get on the stick and take care of this errand by next Monday could find themselves 8 days from now uninsured until 2015.
Okay, because that was going to be my question. So I didn't sign up, either I forgot or just too confused to take some action. But now I'm sick. Now I have a hospital stay. What happens in that kind of scenario? What
happens under that scenario is what would have happened a year ago or a year before that. You're on your own.
Okay.
If you don't have the coverage, you're stuck with the bills.
We sort of reported on all the creative ways the administration was trying to get the attention of especially young people to sign up. What group is least likely to have complied by now?
Well, young adults are the most important target market that hasn't been reached the way they wanted to. Based on the most recent federal report on the sign-ups, only about a quarter of folks were between 18 and 35. They wanted more like 40%. And the reason for that, in case anybody can't sort of piece it together, is that with any kind of insurance, you need some people who are paying in but not drawing down. So the idea is to get younger folks in, paying their premiums. That'll help cover the expenses for everybody else and also protect those people if they get sick, whether it's this year, next year, or the year after that.
Okay. Let's show those numbers one more time before we let you go. And I want thank you to Jeffrey Young, healthcare reporter with the Huffington Post. These are the telephone numbers that you need to call. I would presume if you need help signing up or what have you in D.C. and Maryland, and then the federal number up top. Still about 1 million to go overall to meet the criteria here. Jeffrey, thank you so much.